Hello again. So yesterday, President Cyril Ramaphosa reiterated that the state of disaster will soon be lifted, but some COVID-19 related regulations will remain in place. Earlier this week, the Department of Health published new draft regulations, which will be part of the National Health Act for public comment. However, the Solidarity Research Institute says these regulations are out of touch. To expand further on this, we're joined by Connie Mulder, head of the Solidarity Research Institute. Thank you very much, Mr. Mulder, for availing yourself this afternoon. So just this morning, getting news from the United Kingdom that they have scrapped PCR requirements for people who are traveling into the country, including passenger locator forms. They will no longer also be required. From the additions to the current health regulations, what stood out for you that seems to be a problem?
Thank you, Duduzile. I think the main thing is we've gone back in time with these regulations. It's like these regulations are meant to be in 2020, and we're in 2022 now. We've had 4 waves of COVID. We've seen that in the latest Omicron wave, healthcare was not under any pressure, which suggests that we do have the capacity, without any special measures, to handle the burden of disease that COVID would place on South Africa. And that is the number one reason for all the regulations that we had under the state of disaster, was not to stop the virus. You can't regulate a virus. It's not going to stop. But to make sure that we have beds for everyone who needs one in a hospital. We're at that situation now, which means none of these regulations are necessary anymore. We do not need to have a situation, for example, where if there's one COVID case in South Africa, we force people to wear masks and we force indoor venues up to half capacity once again. This just does not make any sense. What these regulations are in practice is lifting the state of disaster in theory and creating a state of permanent disaster, because these aren't temporary measures anymore. They're now permanent. Now, this flies in the face of what is happening internationally. Internationally, you've just spoken about the United Kingdom, Denmark, Portugal, Sweden, even the Dominican Republic have scrapped all temporary measures, saying this is an illness that we're going to live with, but we have the capacity to live with it. And South Africa is going the other way and making our temporary measures permanent. For some reason, I don't think there's a lot of rational thought that went into these regulations.
You speak of reason, just from, your conversations with your peers and having taken a look at these proposed amendments. What do you think is at the heart of it?
At the heart of it, unfortunately, it looks like government wants to be seen to be doing something, but they didn't actually think if any of these things will work. That's the part that bothers us. Is in 2020, obviously, we implemented regulations not knowing if they work, but we are in a situation now where we can actually do an in-depth analysis, seeing if masks, for example, actually work in limiting the spread, if they're still necessary. We did none of that. We just assumed everything that we implemented worked, in spite of massive evidence that we did not really get out of this pandemic as well as we should have. Yet we implemented all the measures that wasn't particularly effective, and now we've made them permanent. That is massively worrying. The second part that we find disturbing is we've got this myopic focus on vaccination rates, yet for some reason South Africa is estimated by, I think it's Prof. Shabir Mahdi as well as Discovery Medical Scheme, to have already, 80% of South Africa has already contracted COVID-19 and has a degree of immunity, which means when we're talking about group immunity targets, we're pretty much there. There's no reason for us to really focus this specifically on vaccination, where we've got massive amounts of people who recovered and unfortunately several thousand people who died. This, however, means we need to start re-looking at what measures do we need, what non-pharmaceutical interventions do we really need, since we're now at the point where COVID-19 can be treated as an endemic disease, no longer a pandemic disease. We've got sufficient capacity in healthcare, we've got sufficient immunity so that we can handle the burden that this would post on our healthcare services. It's going to be a folly if we start thinking we're going to regulate disease out of existence. Unfortunately, COVID-19 is not going away. It's going to be with us for a very long time, but it's going to become part of the cyclical disease burden that the humanity has had for its entire existence. We have the capacity to handle this. We don't need extra regulation.
So under the new rules, self-isolation will be available to those who either have access to online shopping with contactless delivery, or who can show they have the support of friends. They must also have access to the internet and a phone that allows the daily reporting of symptoms. You bemoan that these measures have been extremely poorly worded and no targets for the repealing of the measures are mentioned.
Exactly. So at the moment, the measures are to such an extent that if there's one COVID case in South Africa, theoretically these regulations could apply to the whole South Africa. You need to obviously notify that there's COVID, but we're going to shut down every single municipality, or we can do that. We can force every municipality to get to this way. Along with the absurdity of stating that you can only self-isolate, the alternative would then obviously be that the government would force you to isolate if you don't have any of those things. Now, this is not what we actually did during the pandemic even. You need to let people be adults and make their own decisions. We don't need these strong regulations anymore. We're in a situation, if we were in 2020, we could make out a case saying we don't know a lot about where COVID is at the moment, and that means we need to be extra cautious. But we've now gone through 4 waves. We've had a last wave with basically no regulations and almost no pressure on healthcare. And we can see internationally the world is moving out of the pandemic. For us to now decide we want a permanent pandemic, which is what this means, that's just folly, and it's going to hurt us not only economically, but even healthcare-wise.
What options are available, to you? Because this process is open for public comment until the 15th of April. Are you contemplating litigating?
We're not going to jump the gun. It's at the moment these aren't final regulations; they're only proposed regulations. So we're obviously participating in the legal process as much as possible. We're going to hand in comment on these regulations, stating we just don't think they're not necessary, they're out of touch, and they're not rational. If the process then continues and government decides to implement these regulations as is, then we're looking at several legal options, yes, because somebody needs to have some common sense in South Africa.
What would you say to a school of thought that says every single government has the right to determine, how to keep their citizens safe with, this pandemic, and the South African government believes they're doing the right thing?
Yes, governments can obviously determine that, but they need to be rational. And if your citizens are telling you this is not a big threat, not anymore, we don't need these regulations, then the government also has to listen. You can't just arbitrarily decide for my own good what I should be doing or not be doing. That's not the way it works. Otherwise, government should be implementing these measures for every single cyclical illness that we have, if the goal is to have 0 deaths due to illness. But that's a utopian idea. That's not going to happen as long as we're on this side of the grave. Illnesses in humanity have been, unfortunately, they've been part of our history. We have a massive health infrastructure specifically to deal with the burden of disease. And if we can deal with the burden of disease, which we can, there's no reason to have extra regulations for this specific illness.
Connie Mulder is head of the Solidarity Research Institute. Thank you very much for availing yourself this afternoon.